Hi, everyone, and welcome to Conversations and Plugs. My name is Cliff.
Hi, everyone. My name is Wago Joy, and welcome to this episode.
And as usual, we must subscribe.
Down below.
Yeah. All right. Yeah. And click the notification bell. So every time we drop an episode, you're able to get notifications.
Yeah.
And today,
we have a very special guest.
Indeed.
Because of her approach to transformative healthcare, very holistic. During our conversations, I know we've talked about several models, but I just want to first start with the statistics of preventative and curative healthcare. So in Sub-Saharan Africa, over 70% of all healthcare budgets go towards curative care rather than preventative measures. And early screening can reduce healthcare costs by up to 30% and improve patient outcomes. Another thing that's really that will tie into this episode is about adoption rates of holistic healthcare. And it's been increasing by about 25% over the last few years. So Dr. Zena, based off what we know about the statistics, I'm finding it very difficult to introduce you without you introducing yourself. I feel like you'll introduce yourself better. Then we can now go into the stats that I was mentioning.
All right. So I'm Dr. Zena Kerubo, famously known as Dr. Z to my patients. So in terms of who I am, I'm a medical doctor by training and by profession and what I do on a day-to-day basis. I have over 16 years in practice, having worked in government and private sector. But also in our space, we refer to some of the doctors as amorphous in terms of the space. This just means doctors who are not only practicing in terms of being in the clinical space, because I also look at healthcare, what happens at the back.
Yeah.
How can we make sure that the delivery of healthcare actually achieves or attains the outcomes that we desire? So when you look at what I've done, a bit of supply chain in how we can manage, all the products, the people within the healthcare space. So I've looked at MBA in healthcare management in terms of my exposure. So there's the clinical side and there's the, can I say back end, if I can put it that way, in terms of how healthcare can be delivered in general.
Yeah.
Who is we?
So we, how could I forget that? So I'm also a healthpreneur.
Healthpreneur.
I like that.
That's so cool. Mm-hmm.
So an entrepreneur in the healthcare space, 8 years going now. Maybe I should say I've survived it. So 8 years. And I work with two wonderful ladies. There's Dr. Wambui.
Yeah.
And there's Dr. Sally.
Yeah.
Those are the people I would say I work with a lot in terms of on a day-to-day basis and just looking at what we dream as regards not only the country, but truly dream about Africa. Because the organization that we founded, which is our really precious baby, called Sante Reva. Sante Reva, you. So Sante basically means health. And Reva, that is in French. And Reva, in terms of Latin, just looks at renewal and refreshment or rebirth. And our dream is to get everybody to rejuvenate, their bodies. That we are born and we grow and everything, works out in a manner that is predictable. But it reaches a point where we are not just as productive, So how can we inject back that oomph into health?
Yeah.
That's how Sante Reva was actually birthed.
Yeah. And even we will revisit Wago's sexy statistics.
They're not mine, but yes.
Right. But what got you into the business of healthcare? Like, what was that journey like?
I think in terms of how this was birthed, it was a desire. And it was a simple desire to just educate the patient. And this comes right from, I guess, my training, that I happened to be in a space where I was talking, and I remember the really first patient was an old lady. And this was third year when we move from theory now to the practical side. And I got to speak to this lady, and it was during an exam. And you're supposed to get all the information, and then you'll be asked all these questions. So you try to draw as much as you can. Then I meet this old lady who basically drew down their health. This year, this happened. I was changed from this medication to that medication. I was diagnosed with this, but because of my risk of, I reacted to this. I cannot take this because of. And I remember I didn't have many questions to ask. Thank God I passed the exam, but part of that, I felt like she actually gave me all the, the cheats.
More Kenya.
The more Kenyas, if you can look at it that
Leakage.
way. And I just remember thinking when I was leaving the exam room is, I have parents who've been on medication. I have relatives, at that point, I didn't know much. But the most I always get is I take a white tablet, I take a green tablet. And we laugh about it because when we ask guys, what medication were you on? And they tell us it's white and it has a line. There's a line in between.
It's like Piriton.
I always feel like that line is supposed, to predict everything. And here's someone who is not only telling me about the medication, they're telling me about the complication, they're telling me about their risk, they're telling me about basically what they cannot take in terms of allergies or just contraindications. And I thought, what if my dad, who is hypertensive, would really be able to give such information?
Yeah.
Wouldn't it just fasten decision making, but also make sure that the healthcare that they get or the care that they end up receiving is really the appropriate care, that we don't have misses. Why should I try this when it was tried before, or it didn't work, or it gave us a complication? So that's where it all started.
Mm-hmm.
Then I came back.
Came back from where?
Yeah.
Aha!
We need to go there.
I'm like, we've got to revisit.
So I happen to have trained in Romania.
Yeah.
A university by the name Carol Davila in Bucharest, which is the capital city of Romania. And when I went there, I didn't know much about Romania. I thought it was Rome.
Wow.
And talking of your geography lessons.
You're like, guys, I'm going to Rome.
And the most interesting thing about Romania is when we leave the country, we all, are always thinking, somebody has gone to greener pastures and it's a place that you'll probably economically transform from. Romania is interestingly a third world country within the European Union. Okay, within the European Union. And they didn't get their independence, far back. I believe it's around 89. Okay. When you talk about Romania and Moi...
There was a dictator who was actually toppled.
Ceausescu, yeah. So when you look at the history with Moi and everything, there was that name that, came up, yeah? And this is the land of Dracula, by the way.
Yeah, I was thinking that, Transylvania.
Transylvania.
Yes.
So that's Romania. And I was there for a total of 8 years.
And everyone knew you had gone to Rome.
Well, we knew that like before we left the country.
Okay.
So when I came back, I was taking a break and I'd gotten a scholarship. If this ever gets to my teachers,
too late now.
I'm sorry. But I actually got a scholarship to go back for neurosurgery.
Yeah.
And when I came back, I thought there's a lot more we could do here. And I stayed with that visa, which expired in 2015. They kept on, it was open. I could still go back. But I just decided, okay, let me come back and practice here. So when I came back, joined government and did my internship, worked there,
Where
progressed.
did you do your internship?
So my internship was in Narok.
Romania to Narok.
Yes.
Express.
Yeah. So Narok was interesting. Because,
when was this? Which year was this?
This is 2009.
Oh, okay.
I believe.
Mm-hmm.
Look at me asking. So I was in Narok for a year and a half. Then after that, I moved to Kisii. And I happened, I believe everything that happens is always for a reason, because I happened to land there and I found a very passionate doctor who was older, and his sight, was not favoring him, if I can put it that way. It was declining. So it meant I needed to be trained on a number of things. As now a medical officer, and I was managing interns at that particular point. And I happened to work in the OBGYN space, hence my passion and the work I'm doing around cervical cancer, by the way. So handle that. And then after that, moved to Nairobi, private sector. I was a doctor for 3 years, 2-3 years. And then after that, I got a promotion and got into management. And I guess that's where the exposure and the interest on what transpires at the back. Because at the end of the day, you know, if I'm somebody who just delivers, it's very easy to come in and say, but why am I not having my tools? Why is this not sitting this way? Why are patients coming this way? But now when I got into management, then it meant the buck stops with you. So decision-making came in, looked at who seeks health where are you placed? Because you can imagine if you're in the health sector, you imagine health is the most important thing to everybody. And there's nobody who can deny the fact that, you know, your healthcare really is important. But this is when now, when you're trying to get this out there, then you realize, while it's a sexy thing to say that health is the most important, that's not where we place our priorities. Yeah, we were joking once with Martin, and he was like, "You guys, I know health is important, and you guys imagine, you know, that's the most vital, and I understand that. But as an individual, truly, where do you prioritize? If you were to think of your bills right now, where do you prioritize? And the truth of the matter is, we think about the landlord. You know, you're so scared of not paying rent. Then you think about school fees. Then you think about, you know, all those things.
What to eat.
So health is truly not the first thing that
it's not top of mind.
It's not top of mind at the end of the day. And we only realize that we need it or we don't have it right when we lose it, if you think about it, which in that sense still works with the space where I work in terms of preventive. You really cannot measure it because it's not something that I can solidly say, this is what we avoided. We are putting in resources to be able to prevent you from getting a heart attack, for example. But if you're not in an environment that is risk averse, as ours is, then how do you measure? Maybe I wasn't going to get a heart attack after all. Right. And that's why preventive healthcare becomes a hard sell if we are not looking at outcomes. Yeah. So getting into management, all these things now came in because how do you market healthcare? How do you go out there and tell people, come on, guys, you know, we need you to come to the hospitals. And if I told that to my grandma...
Come to the hospital when you're not sick.
Now, initially, because you see, the system trains us in a curative perspective. Yep. So all this time when I was joining in, it was let people come to hospital for treatment because that's what I've been trained. I didn't go to school and I wasn't trained that, look, just make sure people do not. I go in and I'm trained about the body and I'm trained about what can go wrong with the body. And so I come out clearly trained in a curative angle. Yeah. So when I market it, if I'm to tell my grandmother, at some point when I was getting into business, even my parents were like, so basically you're banking on people getting sick for you to make it. And I'm like, no, not really. Because it's a hard sell in that sense. So during this time is when maybe the desire to come and, can I say influence? Yeah. How care is delivered, when it's delivered, where it's delivered. Because when you're in a large organization, there's also bureaucracy. So some of the things that, you know, you talk about, and I remember that time talking about wellness, and wellness was a word, you know, that was, you know, clickbait. Like you hear it every so often. But I had a problem, and I have a problem with how we understand wellness as was. So out of that frustration, that's when we thought, okay, let me move out. I was feeling like we're not inclined in terms of what I look into versus what the organization looks into. And that's how I jumped into this gray area that is entrepreneurship. Yeah. No family background. I envy those who experience this in terms of my parents, you know, ran this and ran the other. My folks were bankers.
Okay.
Working in a bank that was UK originated, at that time Barclays. So they had structures. Everything was just perfectly, placed, okay?
Yeah.
And therefore order was, I get in, I get trained, I get this illustrious career in terms of employment, and I was jumping out to try out this entrepreneurship, and they're not getting it. You're in a sector where jobs are there, like you actually
Why do you want to
need
open
it.
your own stuff?
Why do you want, not even open, why do you want to go where you're not sure? And at the beginning, maybe the first 2 years, we even had a bit of a rough patch with my mom, because she was just wondering, like, shida za kujitakia, like, why are you getting into a space where now things are unpredictable? You left a really good salary. And I asked myself the same thing we asked ourselves, like, guys, could we just jump back? Then we realized,
You're going back into the
too
system.
late. We had seen something different. There was a dream, and there's nothing that, I always tell people, passion is very dangerous. When you're passionate about something, and my colleagues, Wambui and Sally, keep on telling me my brand is passion. And I keep on telling them, passion is like a drug. If you don't measure it, it will make you do very unreasonable things. Because you're really just obsessed with attaining that. What you say, Cliff, a dog with a bone, yeah? So when you're passionate about something, some things don't make sense, At some point, we were spending more than what was coming in. But for us, it was like the idea of care being delivered
Well,
well,
like how it should be.
and to you, and us getting outcomes in a population that is enjoying life. And our tagline is, health, well-being, life. Because at the end of the day, when you look at it that way, then it means everybody that breathes is truly like your audience at that point of view. So that was us. Yeah. There were tough times, there were good times, but in terms of the impact, it's a space I always tell people I'll never regret that, because in terms of impact, in terms of seeing how people's lives are changing, that has been huge. That I know I cannot get it in the system as is.
Yeah.
And the thought of one day when Sante Reva will be that brand that will have really have made it, guess what? It will mean there'll be so many people who'll be, happier, living better, having achieved.
Yeah.
So being part of this, I guess the incentive is that the day we will say, we've really made it, then it means there'll be so many people ahead of us that will have achieved it, that the country, that the continent, and just, we keep on saying we're an African brand by Africans, doing it the African way as we tell the African story. Because even statistically, we don't have a lot of information about us, about medication on us. And we're like, one day we will get to this space where we will contribute to these statistics, to this research, to, just having our voice. So I guess that, I don't know if it answers it. It's a very long-winded reason as to why we started, but most importantly as to why we've stayed. Yeah.
In the game.
In the game.
Yeah.
It's a big game, but yeah.
I mean, 8 years is no child's play.
8 years.
I think we need repair.
That's 2018.
8 years of
2016.
Of running a
2016, yes.
2016,
2016, my maths.
yes.
Yeah, 2016.
So the company was formed in 2016.
Yeah, that's 2016. And then I'm looking at your business model, which is around care and wellness, which is more preventative more than anything else.
Yes.
Now, juxtapose that against, if you look at our healthcare system, one, I know it's not unique, because if you went to other countries, I think policy governments have thought through, have gotten, some governments are way ahead of, try to be way ahead of the curve in terms of diseases, management, control. Now, when you look at our system, where I was going to juxtapose that against where it feels like our healthcare system is a conveyor belt, right? You're sick, you enter, you're a ticket, you leave. Now, I'm not trying to plug, but for me, I'm a recipient of the care you guys give. And I think I've been working with you guys for the last 5 years. And it's remarkable how far we've come and how much I know about my body from all the annual checks we do and stuff like that. And I don't know what you after 8 years, is your business working? What are the challenges? I know there's a lot of policy issues that I wish would be addressed. And if I look at that whole setup, right, and the ecosystem and the interplay of all the stakeholders, insurance companies, government, suppliers, KRA taxes, and cost of doing that. How have you guys managed to sustain? What do you see the future of this thing that you're doing, and how has the journey been so far?
So in terms of, is it working? Surprisingly, it has taken us time.
All good things take time.
Yes.
Let the cake bake.
It has actually taken time for us to acknowledge that, yes, it is working. Because there were days when we asked, are we just, like really
drinking our own Kool-Aid?
Fucking a dead horse.
Yeah. And because you're more than one, which is also a plus, there's some blessing in having people to walk the journey with.
Yeah.
Because I feel like if I had done it myself, probably there are certain things that would be way ahead, yes, but maybe I wouldn't be here to even do this. Yeah.
Right.
So it's been tough in the sense that, one, what were we doing? We were not disrupting by bringing a new product, which means we were not reinventing medicine. Medicine is there, has been there, it will still be there. Now, if you're not reinventing something new that catches everybody's attention, we were trying to improve something in the value chain, but what Sante Reva wanted to do is improve the delivery. Not only improve, but literally, can I say, do a 180?
Yeah.
Clear the space and just say, this is how your care should be delivered. It just happens to be in health, but truly this is how care should be delivered. Okay? When we look at, the changes that have happened, like even in organization, because we work with corporates right now quite a bit, when you look at even the titles that we get, so human resource, we no longer talk about human resource manager. We talk about human resource partner, yeah, customer experience executive, yeah. It just used to be the customer care person. Why are we having all these changes, even in titles?
Head of people,
talent acquisition, and talent advisor.
Yeah.
You'll notice that what is changing a lot is basically the experience industry, if I can put it that way. Everywhere where service is being delivered, but where what you feel as you go through that system, we are changing the terminology. If you think about the police force, we changed from police
to police service.
to police service.
Yeah.
Why was that important? Okay.
From people containment unit.
You're trying to change what somebody will feel through it.
Through the arrest?
Yes. Okay. So if we're not trying to get gagged.
Okay, sorry. I'm back.
If we are moving from a situation where, if you look at Maslow, when we think about food, shelter, the basic needs, those are the deficiency needs. If you're looking at how they're defined, it means you actually need them to survive, okay? Now, after we get that, after you have shelter, after there's food on your table, then we notice that we have other demands, what we call now growth needs. And that's the space we're in. That fine, I have a job. Fine, I have a home. Fine, I have a family. But what's next? Can it feel better? Can I enjoy it better? Yeah. So you'll notice right now it's, when we say manifesting and everything, we're all looking for a certain experience.
Right.
Luckily for us, I guess we were ahead of our time because we tried to change that experience, change this from the treadmill. But that meant that it was not going to be revolutionary in terms of time, that we will just close our eyes and blink and we're in a new era. Because now we have to convince people who are used to getting things a certain way, where a system, because we are one organization, okay?
Yeah.
We're trying to tell people, fine, you've gotten your headache sorted, but that is putting an elastoplast on a problem. We need your head sorted still.
Correct.
But looking at it from a wholesome perspective,
Right.
that your body has more than just the physical, there's the mental, there's the spiritual. How are all these things interconnected? And if you think about it, it's actually going back to the basics. That there are certain words that you'll keep on interacting with when you talk about preventive and everything. So, for example, there's health. And the truth of the matter is, we all agree that health is not just absence of disease. That sometimes there's nothing we are diagnosing, but you're not just feeling right. Then when we move from health, because we're looking at a balance of your life in general, so your financial health, your spiritual health, name it, your support system, then we look at the physical. Then we move to you trying to seek a way in which that balance is maintained, because health is static, that you're healthy now or you're unhealthy. When we look at wellness, it is the journey to seek that perfect state, okay? But now we introduce another term, which is well-being. Well-being is continuous, okay? Well-being is basically a state in which not only is there balance, but there's something called a happiness index, that there's satisfaction. And that's where quality of life is. That I can get you to a well-paying job, that I can get you in a very economically cushioned environment. Because how do we interpret success? Most of us attach that to money, right? So if you're really
That's
getting
your
money,
identity.
yes, yeah. So if you look
Your
at the
self-worth.
superficiality of where we've gotten, it is money. So the more money you get, it is assumed that
Your happiness index
your
goes up.
happiness is up there. But we've come to learn that that's not it.
No.
Okay. That there's this thing called happiness index. Yeah. That sometimes you could be on a bicycle, but you're way happier. Why do people leave well-paying jobs to just go and get some other job? Sometimes it's peace of mind. Sometimes it's autonomy. Sometimes is growth, pattern. It's not always about money. Yeah. So you imagine us coming to change and tell you, fine, you've been getting this and it's available elsewhere, but it's how it's being done that is a problem. We're not saying that whoever is seeing you is wrong. We're not saying that whoever is out there is not even qualified. Let's assume we are starting from you're being seen by a qualified person. But all we're saying is the scope with which they're looking at you is all wrong. The problem with that is most likely you will understand it after you experience it, which then slows down how we grow. Because then it means unless this person goes through this new treadmill, as we are saying, they would not really know what it is. You know what they say? You eat food every day, your mom makes the food, and you're like, she's the best cook. Until you go to someone's home and then try it, and you're like,
been eating paper. Yeah.
It's like my mother's cooking was not that good anyway.
So it's exactly that way. That unless you get to test then. So that, I guess, has been the biggest hurdle.
Yeah.
It has been the biggest challenge in how you can even get your word out there.
Yeah.
So that has been the toughest journey. But it's also, I guess, the most interesting, because now that we get to hear the stories, because healthcare is designed in a way that feedback does not need to always come back. That I challenge people and I tell people, how do you assess a drug being a good one in terms of preference? If you look at the traditional way of doing things, if I give people medication and they don't come back, it is assumed that
they're fine.
They're fine. But they could have gone elsewhere or they could have died.
I was going to say that.
You understand where the
like
problem is?
There's a reason they never came back.
Yes. So now we are enjoying the loop where we're getting feedback.
Yeah.
And this is the most satisfying side of how we are practicing that health, that we're getting to actually enjoy that feedback. And then we're realizing, this is worth it. So back to your question, is it working? Absolutely.
Oh, wow. Yeah. That's
we're
amazing.
getting more and more demand.
Yeah.
We're getting more groups, coming, okay? And we're getting this word out there. When you think about the system, let's have some facts that at the end of the day, healthcare will only be at its best when it's practiced with the whole community in mind. Healthcare, unfortunately, practiced individually does not add up, because think about the COVID time. I could go and access care and be treated. But if my household, if my neighbor, if the teacher at school is exposed, then what does it mean? That my prevention then does not add up because I interact. So healthcare has always have to be looked at in a macro aspect. And that I would like to state that at the end of the day, be it the country, be it the continent, we will achieve the most if this is done from a government perspective. And therefore, we think about policies. My only challenge is, again, the system is trained to be curative. The system is trained to look at structures. So we assess the success by the number of hospitals we could access. I'll give a very good example. These are facts that are out there. There are many hospitals, right? And we could come up with dispensary and the like.
It's like, let's build more hospitals, let's build.
Yeah. But my question is, what value does it add to have a building, but you don't have medication?
And we've seen that across the region. Yeah.
Okay. So I keep on saying, can we go back to the basics of quality? And we're talking about the Donabedian question, that when you think about quality in whatever industry you want to look at, structures, processes, outcomes. The traditional way of doing things is we get structures, then we tick and say things are there. So how many hospitals do we have?
Tick, tick, tick. Dispensaries, Nini.
A level 5 in every.
Let's hire more doctors, nurses.
How many people are in there? Push them in. Okay. But if we just stepped back a bit and decided to look at this equation in what the Donabedian model actually proposes, that we start with the outcomes. Let's look at what we desire to have. Once we know what we desire to have, so for example, what are the top killers? Yeah, if for women it's cervical cancer, if for men it's prostate cancer, if high blood pressure is the one that is making us need dialysis more and more often, then the system should be designed in a manner to respond to that problem,
to that need,
to the cause.
And statistics we have.
Of course, in plenty, I'm sure.
Statistics we have, yeah. We were laughing about the KEBS statistics the other day with Cliff, yeah. When you just get in and look at some of that, not KEBS.
Kenya National Survey, Household Survey.
Yes.
Yeah.
Yeah, KEBS. I mean, KNBS, Kenya National Bureau of
So when you
Statistics,
look at all this data, if we have it, what are we doing with the data? That data should then dictate,
inform,
how we distribute our resources in terms of budgets. It shouldn't be just, a whim like, oh, now I feel like
I don't think
health.
it's a whim. I think it's, we are having a systemic issue where it is about the question I was taught in law school was, kwe bono? Who benefits? And therein lies part of what is ailing us in terms of the design of the healthcare system.
And many industries,
and
actually,
many industries,
to be fair.
It's not just the healthcare system as well. So who benefits becomes the key question.
But that's the problem, because if we are to transform healthcare, or even just health in the country, we all have to step back. So even the SHA question, I know it will pop up at some point.
It was not going to, was it? It had to.
We're so tired.
I keep on saying,
like,
let's pull back
Fantastic
and ask ourselves,
intent.
what would be the ideal place we would want to be? Because if we don't dream bigger than what we have, then there's a problem.
So what's the ideal place?
what's the ideal place that would have a population that would be as productive as we could get them.
And not a proportion of the population, the population.
The population.
Okay.
I keep on talking about some of the terminology in the preventive space in terms of the kind of healthcare that we are practicing. Talking of experience, talking of where we're going. Now, naturally, when we are born, we progress the natural way. At some point, a disease hits, we get into the system, we're given meds. If it's something that can be reversed or treated, it subsides and we're good and we progress. But even after we get better, so for example, when you get a flu and we give you medication and we send you to work, you can show up, but you're not as productive as you can get. So if you're to look at it that way, that we get unwell, and it keeps on adding up and adding up and adding up. And at some point, you're not giving 100%, okay? Then age catches up and the body does its thing, okay? And then productivity goes down. Then at some point, a stroke hits or something major. Then we say, no, we'll fix you. We'll get you, some med aids. Let's get you a wheelchair. Then you stay in for a number of years. But I keep on using my maternal grandfather's example that he was in a wheelchair for 10 years because of a stroke. While he was alive, and we are happy about that, and there's a morbid thing, me coming from healthcare, in a sense that we are so obsessed with the length of life, okay? That sometimes even when we are told nothing much can be done, we will still, get money, go outside the country. We will try until we can't try anymore. And that's just basically in our system in terms of who we are. So if you look at it naturally, if we don't intervene it, your health will deteriorate. If you look at history, somebody will die, we'll dispose of them, and we continue. Then comes medicine that was supposed to improve that, what we're calling health 0.20, that we wait for you, then when you're diagnosed with something hits you, we come in and intervene with medication. But we never get you to optimum productivity, okay? Then you take meds and everything, and we continue, and it declines, but at some point, we get you on a plateau. Until then. So we just say our lifespan. The longer you can live, then we must have been successful. But is that really it?
The quality of life is...
Quality of life, if you have to be on a bed being turned every time, if you have to have diapers being changed, and we laugh because there are people who are like, just keep me until I can't stay anymore. For me, I'm like, you know what? I don't want to be on assisted living. If I'm gone, I'm gone. Yeah. And that is because when you get exposed to the idea of now health 0.30, what we believe we're working on.
Health 0.30.
Health
3.0.
3.0. 3.0.
Okay.
Did I say health point?
0.30.
3.0. No.
3.0.
Health 3.0.
I love it. Yes.
Is basically now having the proactive approach to healthcare, that we don't wait for you to get unwell for us to intervene. But what we are looking at is the quality of life and productivity. That's the measure. And now the discussion changes, and this is something I would encourage more people to read about, as we move from lifespan, the obsession with lifespan, to health span. That how long do you have your health at the best form ever? And that means that productivity is, yes. So we keep your productivity here until you're ready to go. And you just drop, you go, but it's essentially you lived it your way. You understand? If you're to look at it in that manner, that you enjoy your life.
That's a huge radical mind shift.
And when we are practicing, we keep telling people we are not trying to avert death. And guys are like, death will come. Doc, what are you trying to say? Like, you can't be a doctor and you're saying you're not preventing death.
We're not getting out of your life.
Yes, we're all
not getting out of your life anyway. Yes.
So if we start with that we're not getting out of here alive, then how about when we are here,
let's make it count.
Get, to enjoy it and make it count.
Yeah, correct.
And that's now the healthcare that we're talking about. And therefore, the transformation is that we move from reactive to proactive, that we have to anticipate these things and therefore prevent, okay? We move from the healthcare that is volume-based. So the more people who come in,
oh man, that's
to value-based. That I will be measured as a doctor not by the number of people I have interacted with, but the number of people whose lives I have changed.
Oh.
And not changed to the worse, but improved or sustained in good state. Okay. So then that changes. Then I have to welcome feedback and I have to go and look for this feedback. Now I have to tell patients, look, I know you always go and get medication and just get well and forget, and then you take the cuckoo and the whatever to the pastor. But now, even after you do that, could you just let me know that you're okay?
Yeah.
Okay.
Yeah.
Could you let me know if this medication worked? Most importantly, did it cause any side effects? And therefore, if I learn from that, because medicine is all about experience, if I learn from your experience, I can use it on a second person.
Correct.
And that's where I become, an authority in a certain area because I have used this many times. So we have to proactively look for the outcomes, then dictate this. Policies, technology will have to be at the core of this. Yeah. So move from institution-based. We're not waiting for you to come. Now we get into your homes. Why? Because guys have gadgets. Sleep is a big thing.
Yeah.
We will never know how well people are sleeping unless we actually probe.
You get in bed with them.
Yeah. Literally. Literally.
Get in bed with them. Yeah.
So that's the sort of healthcare we're looking at. Value-based, proactive, and therefore that's preventive. Distributed, not waiting for you to come in. Can we use your gadgets? Can we speak to you? Can we educate you? Can we hear the government speaking to its populace in terms of prevention? What do we need to do? Because if we keep on buying equipment to investigate for cancer, guys will come. They'll eventually get there.
Of course, eventually.
So the ideal is, can we target a population that does not get
to there? Yeah.
And therefore
more
we'll
educated.
do a lot.
Yeah.
We will educate them. So when you look at our model, in terms of how we approach, there are 3 pillars that take place in any service that we deliver. And it's my hope that those who've experienced, both of you have experienced.
Yes.
I hope that this has come in the sense that 1, there's health education. 2, there's screening. And 3, there's intervention.
Yeah.
So when it comes to health education, it means even when you come with that headache, that I will educate you about the types of headache, why I'm thinking this way, why I'm asking about your sleep, why I'm asking about your allergies, and therefore this and the other. So that next time when you get that headache,
Like,
and you interact with somebody else, you'll come with that information.
Yeah.
Doc, I've had it for 2 days. It is intermittent. It is da-da-da. It's throbbing. Da-da-da. It affects this. It's affected by light. It's da-da-da. All that then just fastens the decision making. Yeah. So health education does not mean just coming to look for a crowd and teaching them. It means every time you interact with a system, you should be knowledgeable about your condition after you interact with the system, and you should be empowered to be able to take a front seat. Because at the end of the day, I say something to my patients that used to bother people and now they're used to it. I'm like, I only get a peep at your health for those few minutes that you give me. But truly, your health is with you 24/7.
Yep.
So if you look at who can influence this health outcome most, it's truly you.
Yeah.
Because you're the one who's with your health.
Yeah.
I can decide to give you something, whether you take it or not.
Up to you.
It's up to you.
Yeah.
So what we are trying to say is that healthcare should have the patient at the forefront. And those of us who are in it, in terms of healthcare workers, then we are assisting you. Yeah. So we laugh and say, for us, it's doc in a pocket. That when you interact with Sante Reva, you actually have your person now, that you can always come in. It's an era of information. There's a lot of information out there.
Yeah.
If you Google, I'm sure the first thing you'll believe is you're dying.
Yes.
Like in the next minute.
Yeah.
So it's my work to do this and then tell you, yeah, this is okay.
You're dying.
But at the same time, get information from
correct.
you, because you have really the best information about yourself.
I find it very interesting because you're literally swimming against the tide, and especially in the market that we operate in. And I want to come back to Wago statistics as well and just go through that in terms of how she opened this discussion. If you want to read that again, that would be amazing.
Okay.
Yeah.
After.
Yeah. So you're swimming against the tide, and yes, we have. I feel very empowered, and that's true in terms of my health. Like I'm very educated. Like at least I feel
My work is
that I
done.
know.
Yeah.
And today it has hit me every time you keep saying that you've got to experiences to talk about it, right? That's how it feels sometimes, because every time anybody have referred to your clinic, I think guys come back, they're like, okay, that was
I
interesting.
get it.
I get it, because you go in there with a headache. It's like, hey, dude, you have vitamin D deficiency.
Yeah.
You need to get an injection, or
Uh-huh.
you basically. I think one of the common stories we share is probably our friend
Who had a cold?
who had a cough for
Yeah.
ages, and I remember
Mhm.
how the whole
Uh-huh.
probing went, and it could have been a disaster. And now I juxtapose that against, imagine a lot of people who walk into a clinic or a hospital, and because you're just a number, a statistic, you're given pain medication, and you're told that you're fine, but you're dying. You have a pulmonary embolism or something, because the system did not take time to actually probe further, understand you're just a conveyor belt. And that's the catastrophe of our healthcare system. But I'll let you just dive into that, and then
In Africa, in African countries, particularly Sub-Saharan Africa, over 70% of healthcare budgets go towards curative care rather than preventative measures. Early screening can reduce healthcare costs by up to 30% and
Yeah.
improve patient outcomes.
yeah,
And then the global adoption of holistic human-centered healthcare models has increased by over 25% in the recent years. So more of the 3.0 is coming up.
Yep.
Yeah.
And you have experience with that, and that's where I wanted to go, because of that particular statistic. Is, I know we've been talking about some globally, some countries policy-wise that have actually moved to more preventive. I was reading about, I think, the case for Rwanda,
Yeah.
in terms of their model, which is around the community-based health insurance system, which, like you said, it starts with the community. But however, I know you have personal experience in Israel as well.
Yeah.
What does that look like? In terms of, I get it, we're talking about systemic issues in terms of the system is set up in a certain kind of way, because I did not realize how important it is for me to be armed with information about my health, and for me to be able to question a doctor in terms of the kind of care that you're giving me, and me to disagree and say, like, listen, boss, you won't treat me like that.
Yeah.
Like, what's the matter? As in, take some time. You can't just give me X. So what's your worldview on that, in terms of, I know there are models that are actually working. So we're not talking about utopia here. It's actually guys who are actually doing that in terms of what we're going in terms of what is growing.
What she's talking about. Now, there are always a few facts that I always say we need to have them at the basis of any discussion as regards healthcare. If we're to achieve good outcomes, if there's anything we're going to remember today is outcomes.
I love it, yes.
That anything that we do, let's look at the output, concentrate a lot. It really dictates how the input, will be dictated. So there are a few facts that we have to get. That number one, we can only achieve this if everybody's on board. I can never say that enough. And I always I think COVID is a really vivid example, that at the end of the day, if we all didn't come in one way or the other, this could turn into something else. If you think about a cholera outbreak, so outbreaks are the ones that usually scare us, but this happens on a daily basis. So if we don't think about everybody, then it becomes a problem. That if we pick a few who we give the very best, the system will crumble, whichever way, because we will overload it in terms of, overstretch it in terms of our needs. Number two, that our needs are beyond just not getting disease. When you look at the WHO definition of health, and maybe we're going to look at that so that we just look at it, there's so many aspects of your life that have to come in for us to define that you're healthy. That initially we just used to make sure you're not unwell, but now we are saying financial health. So how am I supposed to take care of that as a doctor? Spiritual health, how do we balance all that? Your social health and so on.
I have the stat. WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity.
Yeah.
Yeah.
Okay.
So that's Israel's model.
Yes.
Yeah.
Okay.
So that means that we cannot possibly have resources, yeah, if we are to look at the whole group to satisfy all those needs
And sustain.
and sustain.
Yeah.
Yeah. Because at the end of the day, in terms of outcomes, sustainability,
Yeah.
really, because remember I said well-being is continuous. So it's not something we're going to do today. It's something we will do 365 days of the year. Okay. Now, when we're looking at that, then we know that for us to be able to come out of this in a better manner, then we have to pool resources.
Mm.
That means that you could have more than I have, okay? You could have it at some point when I don't have it, okay? But if we have resources that are then coming together to be able to take care of that, and these resources could come from different areas. There are countries that have done, just, yes, taxation, part of it goes into healthcare. And it's so funny that there are certain sectors that we don't give so much attention to. If you ask me, healthcare is about life. If we don't have life, then we're not here. Okay? Education is another one that you cannot achieve good health without having the population knowledgeable.
Yes.
Yeah. There's certain videos you watch and you almost feel, sick or sorry because you realize how out of ignorance there's certain things that we do that then are quite harmful to us in the long run. Okay. So for example, how we prepare food, how we store our food. I'm quite passionate about agriculture. And I feel bad when we talk about how we produce food and so on, because, for example, my parents are now farmers, yeah, Kitale side, name it, all right? Those guys produce, and most of the crop that we get from there is maize, okay? Now, how we store that maize really matters because we've heard a lot about aflatoxins, aflatoxins, okay? And aflatoxins, for us to be able to achieve the best, it's truly how we store our maize. But I don't remember my grandmother, my grandfather being educated on how to store their maize, okay? I don't remember them being told anything about humidity. They just knew like it needs to be dry well, otherwise it will get spoiled. But for as long as it's not spoiled and I can be able to get, flour from it, according to me, it is very healthy.
Yeah.
And I always tell guys, if you look at a farmer and you tell them, eat healthy, they truly believe that they're eating the most healthy diet ever. Why? Because healthy for us means not processed. But there's more to it than that. So who is educating our folks? I remember we were talking to somebody and a FAO, and they were saying that when they went to the supermarket and they were just checking flour, yeah, with some gadget that just measures for you humidity levels and aflatoxins. And they said so many brands, in their words, majority of the brands on the shelf do have aflatoxins.
Wow.
Okay. Now, for me as a doctor,
that's dangerous.
I'm like, we are waiting for cancer to happen. So eventually we will get these cancers, okay? When you look at Ukambani, historically, in terms of liver cancers and the like, think of Nairobi River, how we pollute. So all these things that we are throwing, these companies are owned by you, by me, and the rest. So if that education doesn't get out, for me to understand that when I am disposing this waste, tomorrow it will be my mother, it will be my son who will be suffering from this condition. So there's certain areas that we like it or not, we have to look
even
at
pesticides.
global. Yes.
There's something about Meru as well and cancer.
Yes. Yeah. And when I was in Romania, I remember we were attending a nutrition class. And the lady who was lecturing actually said, there's this chemical in terms of a fertilizer that we produce, but we don't use anymore. It was banned in the 1980s. But we export it to Kenya. And some of the things that they get is scholarships, And I remember them, calling me out, and they were like, yeah. And I was like, yeah, my parents are farmers. We use that. Okay. And they were like, yeah, we banned it. And I realized, look, these things have to work together.
Jodro.
I'm not trying to.
No.
I'm not trying to get into trouble. But just look at some of the things
I don't know
get.
when truth became trouble, but here
Yeah?
we are.
So when you look at these models, in terms of then how these resources are used, the idea of we can be able to take care of everything is Delulu. Yeah. And
Delulu is a Salulu.
yeah, this time it's not the Salulu.
No.
Okay. So one, we have to look at how we are distributing them. We have to make sure that we choose what we put our resources on. But the question is, who is the payer? If you're to have to control the systems, who is the payer? Who is the provider? Okay. Who is the recipient? Who is the, how do you call this, regulator? In our system, the government is the payer.
Yes.
So in this case, SHA.
Yeah.
Okay. They're the ones who are also the buyer because they negotiate the packages for us. We're just told now dialysis will be once and that's
done
it.
by this number.
Yes.
These clinics are the ones who...
So allow me just to say that when I read that, for example, high blood pressure care will be 4,000, was it 4,500? And I can't remember, diabetes was 2,500 per year. They've bargained that package, all right? Then at the same time, they're the regulator. If anything happens to you, who do you report to? The government. But the government also provides the care. So explain to me how the government will call itself out because it provided poor health and did not get what it paid for.
Yes.
While it collected, you understand where
So
the
the
mess
government is judge, jury, executioner.
Everything.
I have a problem with that.
Me too.
Me too.
So, for example, in Israel, there are 4 main insurances that handle health, okay? Meaning the government procures health for its populace, comes and negotiates, and gets packages from these people, and therefore redistributes the revenue.
And then regulates them.
Then regulates.
Quality.
But also gives incentives out of the outcomes that you get. But you see, when we are separated, it's very easy for me to call you out.
Yeah.
But there is actually the same thing I was reading about the Rwanda one. They do the same thing.
Yes.
Whether it's capitation of the facility based on performance or how you're actually doing and treating guys.
So it's very easy for you to control. So we have a
sort of bastardized version of what it can be. So the intentions are good, but however, kwe bono, who benefits, which really sinks my heart in terms of, we could have been getting the best of.
And then also when you look at the systems that are to be admired, preventive healthcare is actually taken care of by the government.
Absolutely.
So in Israel, you're assigned to, some center. They will check up on you when you deliver. They have to follow you up. Your child in terms of dental care.
It's properly devolved.
Yeah. So this is right there. And if, for example, I'm a drunkard and, I'm found in the trenches and whatever, my neighbor can be able to say he didn't take his meds yesterday because da. So if there's a complication, we know.
The community knows.
The community knows.
And that's the doctor.
And that's where accountability comes in. Yeah. I'm sure our time...
No, let's keep going. We're just almost... Yes, I told you how time just... usually just runs. Now we've just entered into... very deep conversation around your 8 years in health.
Yes.
Healthpreneurship.
Yeah.
And it's pretty exciting in terms of the product you guys are putting out there. And like I said, I feel that you've been swimming up against the stream, and eventually it does pay off because I think your community keeps growing. And I think anyone out there, just check these guys out as well. In terms of what they do, it's pretty brilliant.
Yeah.
Margot, I don't know.
I received care from the NHS for a few years. And I remember, GPs were very localized based off your postcode.
NHS is the UK?
Yeah, the UK public system.
Okay.
Public healthcare system. And the GP, you are only allowed to see your GP for 10 minutes because the GP has stuff to do.
The numbers.
Yes. Yeah. Or even if you need care from now the national system, it could take as long as 6 months to get, or even more, to get just care. Yeah. So I find it very amazing that Sante Reva is located within a community. It's located in Lavington, by the way, Mugumo Road.
Resident Mugumo Road, number 28.
Number 28.
Yes.
And they have a beautiful sign out there.
Yes.
I do think that if you're looking for a refresh or your outlook of your personal outlook on your healthcare to kind of be transformed, I would recommend Sante Reva. I have been coming to you for a long time, and it's so interesting because there's one time I spent 1.5 hours with Dr. Sally, just examining my entire life. Some of my markers were higher than normal. And her question was, what's been going on in your life the past 3 months? So that we can understand what your body has been experiencing, which is crazy because you compare 10 minutes to 1.5 hours. But I left there feeling that my health has been taken care of and my spirit has actually been lifted, because bad health actually dampens you.
It does.
And so I'm just comparing 10 minutes to 1.5. My question is how we get to have, how to monetize more of that kind of care. But I think what you're doing slowly is transforming the outlook of healthcare. And so I'm just here to say thank you. I am a recipient. I have seen.
Me too.
My outcomes have been transformed.
Shout out to Sally and Wambui.
I go to my doctors, and even the audience out there is kind of just celebrating. I go to my doctors now as a partner. With my body is here, then there's me, and then my doctor, and we're discussing it. And I find that a lot of Kenyan doctors are kind of like, "Are you a medic?" I'm like, "No."
You're asking many questions.
I just own my body. And I'm proud to say that.
Yeah.
So I do think that what you're doing, your 3.0, will probably evolve to a 4.0. But I do like that you're redefining healthcare in such a beautiful way, a much needed way. And thank you for what you're doing.
Absolutely.
Yeah.
Oh, thank you. This is what I
welcome.
was talking about, feedback. So yeah, true. If you're looking for a place to just discover yourself, understand your body, take control, because that's the essence of Sante Reva. It's not us to, have it checked and keep it for you. It's really for you to take control. It's for you to have your personal doctor who then becomes your advocate, because at the end of the day, within the referral system, if you're to go to somebody else, I'll be your voice, because then we've spent, time with you. And just basically not only understand yourself or discover yourself, but really look at your risks stratified.
Yeah.
And therefore, that means that we all of a sudden change healthcare into a predictable area of our lives. And yet healthcare is known to be unpredictable.
Exactly.
So we are those guys who are, let me say, stubbornly insisting that healthcare can be predictable to the payers who are insurers, or those who are paying out of pocket, to the individuals, to parents, to, name it, to partners, that we can be able to make it predictable. So when we hear these stories, then the answer is it was worth it.
Yeah.
And one of the things I know we talk about a lot is the business must make money.
Yeah.
Right. And as a healthpreneur, I know you face significant challenges even as we wind up in terms of running this kind of model. I know there's systemic hurdles. I would imagine insurance companies would be an issue, especially that you want to do preventative, where I assume then the risk for insurance companies is you must pay upfront for that thing, and it's not as sexy as probability in terms of whether the person is sick or not, and we can get more money from there.
Yeah.
But you guys must make money, and I know it's been 8 years as well. What have been your challenges around that business model? What have you learned, and what are from there, what products have you developed, and how is that looking moving forward? And then your parting words as well.
I guess the biggest challenge is, and I guess
as a woman,
the biggest challenge has been, let me say, financing.
Yeah.
Okay. And accessing funds for this kind of model.
Correct.
Because even when you visit a bank, they're like, no, we want, a place where they'll see someone for 5 minutes.
Yes.
Then that means there's
More
volume,
people.
and therefore that's where I'd put my money.
Yeah.
If I asked you to put your money where they'll see 50 people in an hour versus naturally you'll
three
just
people.
you'll just
Three
jump
people
this
in a day.
side.
Yeah.
But we are challenging that in the sense that in terms of money and the business aspect of it, preventive healthcare, if you look at it, actually makes more money.
It's very
Why is that?
counterintuitive.
Yeah.
Yes. Why is that? As because once I have you in, and you're in either for a checkup, and this does not just mean it's checkups. It also means those with chronic diseases who are hypertensive, who are asthmatic, who have HIV, who have diabetes, that their scheduled visit, you can actually predict on the revenues in terms of the outcome. So if we all stepped back, we will realize that not only does it save the costs eventually, if we came and agreed on these packages and the like, but it actually is, in terms of business, more sustainable if we only got more people into it. Okay. As
and
a
most
woman,
important, life.
Yes.
Yeah.
Quality of life.
And that's life. Yeah. And for as long as these people are alive, even you as an insurer, then you have more people to pay premiums. Yeah.
As morbid as that sounds.
But yes. But when we talk about preventive, people imagine that it's just wellness checks and the like. But part of preventive is chronic disease management. That these people who have been diagnosed, that we handle them.
Yeah.
And one of the things that we pride ourselves with is that we look at admission rates, for example. The highest cost in healthcare is actually is in inpatient. When you get bedridden, that's where the cost comes in. And when you look at economics and health economics, that's where productivity is affected. Because after you leave hospital, we have to allow you some time. We have to look at if it's a child, the mother also can't work and the like. Yeah. So we pride ourselves in the rate of admission. That these people who had complications and the like, we're like, since guys came, when was the last time you were admitted? It's my work to make sure that you do not get admitted. It's my work to make sure that now when you get these outpatient cases, that they're not intense to get you bedridden, okay? That now we can deal with lighter aspects of health that your immunity can be able to actually just fight. When you look at being a woman, unfortunately for business, facts, when you're trying to go and look for financing, there's common speak, which I disagree with, that when it comes to insurance, when you're a woman, chances of you leaving, if I get a partner and I decide to go and become a mother, you'll just leave your business. What surety do we get? And there were questions we were getting at the beginning. What surety do we have that these three ladies will stick in to the end?
You're kidding me.
What if you guys change your minds? And that came into question. What if you decide to go and have a family? What does that mean for my investment? Okay. What if you get a partner who comes and changes your mind or doesn't want you to practice? And I was like, okay. I didn't have what to say because I wasn't ready. So the challenges have been there both as a business, but also as individuals, because as doctors, we are not trained to think business.
No.
Because it's a conflict of interest from our training. You should never think money.
Okay.
The doctor should never think money. And when you think about it from the noble aspect, truly, do you want me to think, how much money am I going to make after this?
Absolutely. From me.
You don't desire
I
that.
see.
Okay. And most people imagine that a consultation, because healthcare is something we all need, that you should just give it. How can you just deny it? It's a service that is, it's life. Yeah. So if I went to a lawyer, they can charge me millions.
Yeah.
But if a doctor just charges me before they see me,
what a mess.
So there are guys who even wanted to refuse to pay. There are guys who would ask us, and this luckily we learned, being a woman also, that the males would come in and say, but doc, this we won't charge. We haven't done much, right? And so we had to learn to separate and say, go to the reception and handle that. Because from the nurturing side, you want to say, it's okay. Then you realize the landlord is like, you're out. Yeah. So that's us. I don't know what else you had asked.
No, I love that very much. Parting shots. Because we're winding up, and this has been absolutely amazing. But we told you how quickly an hour goes.
Yeah.
You just didn't believe us.
Parting shots. as they say, truly, health is your wealth. You have it, you can do a lot. When you see the situations where your perfect form of health is withdrawn, is where you realize that, look, this is important, okay? Number two, we're in an era where we cannot afford not to be aware about ourselves. Nobody will take care of you more than you can take care of yourselves, yeah? My word out there is an opportunity for individuals to take control of their health, to have your voice, to be at the front seat of your health, okay? And therefore modify it. And if you're empowered with this information, that even when things go bad, my mantra has always been, if you know what effect you're going to get out of this and you're okay with it, whether it's bad or good, then that's the right choice. Yeah, that if you decide I'm going to take this and it might poison me, but I'm okay with the possibility of that, then that's the right position for me. Okay. So it's for me to say, guys, we can do better, not as an individual, but do better for yourself, do better for your partner, do better for your kids, do better for your parents. Okay. We would love to see this changing. And therefore, with time, just as ripple effects, we will get the country to change and we will get Africa to change. This story can definitely change.
Absolutely
and
love
we
it.
pray that Sante Reva will be at the core of the health story and that ripple effect. We believe that we are the ones. And if you haven't done your checkup or you haven't
go to Sante Reva.
experienced that
a Sante Reva wellness
healthcare the Sante Reva way, then I'm sorry, you haven't done anything. We are those people. I can confidently say at this particular point.
I have honestly a last question, and this is something we always ask. What does the future look for, like for Sante Reva, and what does Africa's landscape look like for you?
Okay, so in terms of a future, we see one in terms of delivery, that we would have a center or an organization, let me say a model of excellence. That's what Sante Reva is trying to do. And we want to look at an ecosystem. So it's not about clinics, it's not about hospitals just in that case, that we will have a point where you will interact, first point, which will be this clinics. Then we would have, the secondary care in terms of hospitals and the like. But we're also looking at changing how people enjoy their good time, that we want to have a health resort, not just the resorts you hear about, that you could have a health holiday. You're not going to fly out. We would be able to offer that because now we have learned how to look at life and, stratify it and get it there. But also in terms of an ecosystem, we are optimistic that we are going to train one arm about how to deliver healthcare. Yeah. So a training school is also in the future. A supply chain arm is also in the future, and supply chain here, not only for the products. Yeah. And one day my dream is for us to even get into production. Okay. But also looking at the health workers in terms of managing their flow, not only to train them, but also to help them navigate this area. So truly, everything to do with health, we want to have it in there. That we can look at production, we can look at delivery, we can look at
the full value chain.
The full value chain.
But within your model.
Yes.
Dr. Z, it has been an absolute treat.
Thank you.
We told you. Not to stress it. Yeah, absolutely. And
Thank you.
It's time to sign off.
Thank you. Do you want to plug your social media handles?
So you can find us on YouTube, on Instagram. Yeah. You can also find us on Twitter. Yeah. And our website.
You mean X?
On X. So our website where you can get all this information is santereva.com.
Yep.
At Sante Reva in terms of Instagram and X. Yeah.
Absolutely.
Reach us on telephone number 0788 101 501.
Yeah.
Or in terms of email, info@santereva.com.
Love it.
Thank you so
much.
Thanks.
It's been a treat. Guys, subscribe. This has been cool. Over and out.